To health matters, chief medical directors from the 19 northern states are in training to seek ways to reduce maternal and infant mortalities through perinatal death surveillance and response. The policy of the Ministry of Health is aimed at shifting the spotlight to change the staggering data on maternal and child death in Nigeria. TVC News' Kemi Balogun reports.
Currently, Nigeria is the highest contributor to maternal mortality in Central and West Africa and accounts for 14% of the global maternal mortality burden rate. Women of childbearing age account for more than 100 deaths daily in Nigeria due to preventable causes during pregnancy or childbirth. And according to the World Health Organization, 1 in 5 Nigerian children never get to the age of 5. Northeast region in Nigeria has the highest mortality rate compared to other regions, with more than 1,000 deaths per 100,000 live births. These staggering figures is the reason why managing and chief medical directors from teaching hospitals and federal medical centers in northern states are in Abuja. They are being trained on measures to reduce maternal and infant mortalities through the implementation of maternal and perinatal death surveillance and response.
Maternal and perinatal death surveillance, that means watching. Surveillance means watching, looking, making sure everything, the quality of care is excellent, including quality of obstetric care, emergency obstetric care, all the things that is needed for childbirth is in proper position. As I told you, it's preventable. And then the response of it means that when you have a death occurs and you have reviewed that death, there must be some action, something that causes the death that must be corrected.
Labor ward nurses and matrons who come in direct contact with most pregnant women share experiences of how bad it can get at teaching hospitals.
Considering the economy, we'll observe that being in Kano, some, their husbands are not staying with them, they are working either at Abuja, so somebody have to escort them to the hospital to deliver. So we just admit them like that in case if it is emergency, we rush them to the theater. So at the end of the day, most of our mortality recorded are transferred cases.
This gathering also hopes to bring an end to the needless deaths of women during childbirth. Good antenatal services can help to prevent major causes of infant and maternal deaths. This is because most women lack proper access to healthcare service while pregnant, and this can be due to various barriers like cost of hospital visits or even distance from where their homes are to the hospital centers. But most of this also has to do with family norms.
Many people don't come to hospitals because they feel that culturally or economically they'll be asked to, go through circumstances that they would rather not.
In the state specialist hospital, you have fewer doctors, fewer specialists, and a larger number of women coming there because a good part of the services there is free of charge. So you have a large output of women coming in there with fewer number of specialists, and therefore the demand, on the ratio demand and the specialist available is very low, and so you have higher mortality in the state specialist hospital.
The training of healthcare facility workers remains an important element in bringing down the numbers of deaths from childbirth. Kemi Balogun, TVC News, Abuja.